Coronavirus, the disease of 2019, COVID-2019, continues to spread in Uganda, but as the numbers increase, patients on palliative care see their survival becoming minimal, as the disease is believed to claim people on palliative care more than anyone else. In Isinjiro district in Nyamuyanja Chitende village, Nathan Tumwesije, 53 years, has been living with HIV/AIDS for 20 years and a peer educator. He has expressed fears for his life as COVID-19 continues to spread at a time when its cure is still a problem to the scientists.
We have got information saying that those vulnerable people living with diabetes, HIV, TB people, they are on high risk of COVID-19. So that's why I ask, what is the plan of the Ministry of Health for those people living with HIV, living with diabetes? What is there? So they should put much effort about that.
For people who have been on treatment, for example, people who have diabetes, who have high blood pressure, people who have other conditions, they are more susceptible to severe illness and maybe death once they contract the coronavirus and are not managed at early stages. And this message, and of course the science behind it, has impacted the extent to which the palliative care clients or patients and their families can access care. There is a lot of fear that once they move out and once they seek help, once they come to health facilities, then they may contract the virus and then they will be severely ill and maybe be admitted in intensive care units and maybe die. So that fear and it stopped them from seeking help and reaching out.
In March this year, the government of Uganda put a total lockdown on public and private transport as one way of controlling the spread of COVID-19 from one part of the country to another, and as a result, very many patients on palliative care became stranded on how to access hospitals and get their monthly dose of medicine, hence others dying.
There are some cases of death we've experienced. Some of the patients who've been on drugs and they abscond, in simple terms, they miss coming to pick the drugs they've been taking. Like HIV clients, they develop resistance to the drugs they've been taking, and as a result, the disease progresses very fast and develop other complications or opportunistic infections, and all those results into death. During this COVID-19 pandemic, I've so far witnessed death of around 3 clients who've been on HIV drugs. So I can say we've lost some of our clients who've been taking drugs here.
COVID-19 has really affected our work in the care of these patients. Some patients have not been able to come for their medicines here. We have taken long without seeing those patients. They can send borders. And when they send borders, we have still to call home and we talk to the patient in their home to tell us how they are, how the medicine is working. And sometimes the patient doesn't have the network in the home, so we have to call the neighbor, then the neighbor will go there, and then somebody else will talk to the patient, and then the patient will tell them how they are. This has broken down patients' confidentiality, because it's like you are telling everybody your problems, and yet it would have been between the patient and the nurse.
Palliative care is an approach that improves the quality of life of patients and their families facing the problem associated with life-threatening illnesses such as cancer, HIV/AIDS, diabetes, pressure, to mention but a few, through the prevention and relief of suffering by means of early identification and amicable assessment and treatment of pain and other problems. Some patients, especially those living with HIV/AIDS and who preferred to be off camera, accuse some hospitals, especially health center force, of putting much time on suspects of COVID-19, hence neglecting other health services, something that the health in charge of Mbarara Municipal Council Health Center 4, and who also sits on the District Health Board, denies.
Surely it's not true. If anything, I'm talking in aspect of this facility. If anything, it's this time around that we have even been more vigilant. I've told you, for instance, of the ambulance system that was put in place, particularly to ferry emergencies from communities. It hasn't been there, but it was instituted because of the COVID pandemic. Now, a mother who has come to deliver is not a COVID case or a suspect. A person who has diabetes and is in a coma in the community. I remember we picked one client from Kichwamba, up hills there, at the referral hospital. It wasn't COVID-19, it was diabetes and its complications. Service delivery, our gates have been remained open. For instance, one thing about HIV/AIDS care. We are right now receiving many of the populations that are not registered with us here. They are registered from other facilities elsewhere, but they are accessing their treatment and care from this facility. That basically means that we are open and receiving our masses. But as a client, as a patient, when you come to a facility, like what you saw on the gate, you would want to be served early. You would want to leave the facility early. But this time we were saying, no, you have to go through a process of screening. So some of them despair and leave. And they say we have been neglected.
Asimwe Christopher, chairperson of people living with HIV/AIDS in Nyamuyanja, Isinjo district in western Uganda, the Nyamuyanja Positive Group, has expressed fears of losing majority of his members due to transport, which he says has resulted into some patients practicing dangerous alternatives.
Some patients have started mixing up with the grades of HIV drugs simply because they want to remain on drugs after failing to access the hospitals they were receiving medicine from. Because of long distances, patients doing this are many, and we are going to lose them.
Yes, you know, those people living with HIV, they are creative, they are educated. So once she or he came and said, you know, my medicine was finished. I was supposed to go to Mbarara next week or this week, but I'm requesting to give me at least the medicine for 1 month. Then the doctor gave. Then as the COVID continues, the month ends. Problem of the medicine of the starting and the old one, they are different. You can find that you have been reached on second line or first line, and this time you are requesting it test as a new client to give you a medicine as a what? A new client. That is a big challenge on people living with HIV. It is very dangerous. Very, very, very dangerous. It is my worry. You never know, it will develop something. After, when these days, after going to finish this COVID, it will be a big problem. You will find someone is taking the tablets which is not supposed to be taking that one.
Of course, they have died in pain, which is the problem. Because our work is to make sure that patients, even if they are dying, they should die in comfort, in dignity, without pain. But now they are dying in pain because they cannot come to us. Patients with cancer of the cervix, we have a project which helps the patients to go to Mulago and they get radiotherapy, and then they improve. It improves their life, and sometimes they get better and they live a good quality of life. Now these patients have not been able to come simply because of lockdown, transport. They have sat at home and bled to death. They are there, and yet they could have been helped.
Reaching hospice regional officers in Barara district, one Faibi Chomujisha from Kabungo, Ntungama district in western Uganda, a cervical cancer patient, was meant to go to Mulago Cancer Institute, Uganda's national cancer hospital in Kampala, in the month of March for radiotherapy, but it is now 9 months on the road and she hasn't gotten radiotherapy, citing lack of transport means.
In the month of March, I couldn't get radiotherapy as the country was locked. I went back home in Ntungamo district. 4 months have passed and I couldn't access any hospital for my treatment. The pain has been too much.
You will find that majority of the hospices and hospitals did not see their patients on time as it should be. And the survey that we did around April, May showed that 50% of the patients did not meet their appointments. Those were people who had to come for outpatients, the people who come to the hospital to receive their medicine, people who come to the hospice.
However, regardless of the challenges that came with COVID-19, strict guidelines and stigma, some patients with long illnesses, especially diabetic patients in Hoima district, continued visiting their respective hospitals for medication.
Many people were fearing to come. They were fearing to come. They thought maybe they would not be worked on. But the few of us who would go there, at least they would work on us.
At first, I feared for my life. I already have diabetes. Then I go to the hospital. I mix with the COVID-19 patients. I said no. So I stayed home. But later, diabetes shoot up. With no option, I visited the hospital and I was attended to.
The people we interacted with, especially the experts and the patients, raised some possible solutions that would help everyone to remain in good health, and this can be done by revising our health measures on the ground from homes to lower health centers as the country continues to receive more strict guidelines on COVID-19.
A transport means provided by government to be used by facilities, such that when they are in need of supplies from maybe a district or neighboring facilities, they use that. Then for the case of clients, they can take drugs nearer to people. They can be meeting at a certain point in the nearby places where they stay, like a training center. They meet in someone's home who is a group member. Then those drugs they've been picking from the facility that is far, be brought nearer. And if possible, they can take some health workers, those who require being monitored, then those health workers who are trained to do the monitoring from the outreach sites that are called maybe the distribution points for drugs. Then the nutrition part of it, people who are on treatment, those who are on HIV drugs, the diabetics, the hypertensives, those who are taking cancer drugs, for sure they should be given a priority while giving relief foods, because those drugs they are taking require good nutrition. The previous scenario, we didn't see those people being considered as first priority for people to get relief food.
Women in News, WIN, continues to explore the effects of COVID-19 on different types of people, especially the vulnerable groups, and finding out from the affected and experts on the best ways to finding lasting solutions, as COVID-19 is not showing signs of ending soon. I'm Sarah Mobiru reporting from Uganda.